actions and activities we're participating in and collaborating with others to protect LA residents. And then after we're done, we'll obviously open it for all your questions. So I want to start by highlighting our recent collaboration with. Sorry. Do you want me to move? I'm happy to move.
Yeah, we're just trying to move. You got to speak up.
All right, I was a high school principal.
Actually, just
I can
boy,
wait.
so it goes by. Otherwise, you're not doing a damn thing.
Whoever's speaking, if they could sit in that chair, that would be perfect.
Perfect.
This year.
Yes,
This year. Okay, fine. Well, we'll move around. We'll switch ourselves around.
Thank you.
Okay. So as I was saying, we want to really highlight today our close collaboration with both UCLA and Cal State LA to address the measles exposures at each of their campuses. Obviously, on their campuses, we've been working closely the last couple of days to identify the contacts wherever possible and assess their immunization and or their immunity status. We've also worked to educate students, faculty, and staff and visitors so that they know about the possible exposure. We're offering vaccinations, and where appropriate, we're quarantining those close contacts until they can establish that they're immunized or they're immune, or the incubation period for passing along potential case of measles has passed. In all of these activities, we are asking for the help of the public. So you're going to hear a lot today about the need for the public to be informed, to ask questions, to contact their provider if they have concerns, to be alert for the signs and symptoms of measles so that you take swift action if you suspect that you or someone you love or someone you know may in fact have a case of measles. The Public Health Department has a three-pronged approach to tracking any outbreaks. The first and most important for us is to follow up with any cases and identify known contacts as quickly as possible. The second is to always communicate and inform and update our provider community so that they have accurate information on how to screen, how to diagnose, how to treat measles, and how to vaccinate appropriately. And last but equally important, we work with all of our community residents to make sure they have good information and easy access where appropriate to vaccinations. Those three strategies are in play in everything we're doing today. I'm going to now turn it over to Dr. Davis and allow him to provide some context of the outbreak in LA.
You guys want me to switch?
Yes, sir. Thank you.
You could say and spell your first and last name, sir. We appreciate it.
Will do. So hello, everyone. I am Dr. Muntu Davis. I am the Los Angeles County Health Officer here at the Department of Public Health. So what I'd like to do is just sort of give some context with an overview of measles and sort of where we are at the moment.
Spell that name, sir.
Sorry about that.
Okay.
First name is M as in Mary, U-N-T-U. Last name Davis, D-A-V-I-S.
Thank you so much, sir.
So as we've been talking about measles, measles is caused by a virus. It is highly contagious and can stay in the air for up to 2 hours if a person who is sick with measles coughs or sneezes inside of a room. It can also remain on surfaces in terms of that same room and can be picked up by anybody who is in that room during that time, and they could then become infected with measles if they are not immune. So in the current situation, we have 5 cases, 4 of which are linked as an outbreak that stemmed from a traveler who was unvaccinated and traveled out of the country, came back, and then subsequently passed the infection on to 3 close contacts for them. We have an additional traveler who was also unvaccinated, but we have not had any cases of measles in their contacts thus far. We also actually have 5 non-resident cases that were also travel-related. And we have the 5th one is actually something that we should, if you haven't seen it already, we have a release for for that case as well. Now, in this, a few of the cases have been in other places, attending, UCLA classes, as well as being at Cal State LA in the library, and as a result of that, we have a high number of contacts that may have been exposed. As Dr. Ferrer mentioned, knowing what the immunization status is of those contacts is very important for us in order to limit or prevent the spread of measles to others. So in this current situation, because measles is, there are a high number of cases and outbreaks inside of the United States, there is a high number of cases in many other countries, and people are traveling more, we expect that we may see more cases of measles inside of Los Angeles County. Now, I'm not saying that it would necessarily be residents, but it's always that possibility. But as mentioned, we've had about an equal number of travelers just traveling through LAX or traveling through LA County, again, who traveled internationally. So the strategies that we implemented that Dr. Ferrer talked about, the quarantine order, I'm sure, is a big question in terms of when and where we do that. It is actually something that is done only if we know that the person who is exposed is possibly at risk of acquiring the disease and could then pass it on to others. Now, the interesting thing with measles is that although a person may be symptomatic, it looks pretty much like everything else in terms of a viral illness, starting out with fever, having potentially cough, runny nose, maybe some red, watery eyes, and then later shows up with a rash. Now, 4 days before that rash shows up, they can actually pass it on to others. And actually, they can even be not have symptoms and still pass it on to others. And for this reason, it is important for us to identify those who may have been in contact and understand whether or not those contacts are actually immune to measles or not. If they are not immune to measles, then they must be kept away from others in order to not have that unintentional spread of measles should they come in contact with others who may not be as immune as well. So in this situation, this is really a situation that's in flux in terms of us trying to understand the immune status of those who were contacts. I really want to highlight the efforts of both UCLA and Cal State LA in assisting us in determining immunity for those contacts, and I really want to appreciate their efforts. Thank you.
Okay, my name is Dr. Sharon Balter, SharonBalter. I'm the Director of Communicable Disease. So I just wanted to take a minute to talk about how we detect and cases of measles and how we determine who is a contact. So we receive reports from doctors 24/7 who are seeing patients who they think may have measles, and we assist them in testing for measles when that is appropriate. When a patient is diagnosed with measles, or sometimes even before the diagnosis occurs, if we think it's highly likely the patient has measles, we work with the patient to determine where he or she has been and with whom he or she has been in contact, so that we can quickly determine whether or not the person is protected against measles, has had two documented doses of measles-containing vaccine, or has actually had measles in the past. If they do not have documentation, we can sometimes determine this on blood test. So with this in mind, we do want to urge everybody in Los Angeles to know whether or not they've had measles vaccine or have immunity to measles. There are certain people for whom it's very important that they have 2 doses of vaccine. While 1 dose of vaccine is good, and is generally recommended for adults, 2 doses is better. In addition, not everybody who's had their vaccination, especially older adults, have documentation of that vaccine. If you're exposed to measles, it's very important that we see documentation of the vaccine. So we're encouraging people to make sure they know that they have had measles vaccine and can document it. For most people, you can just ask your provider on your next visit if you can talk about measles vaccine. For certain people, it's very important that they make sure that they have 2 documented doses of measles vaccine. This would be true for children who are recommended to get a dose at 1 year of age, and then again at 4 to 6 years of age. It is required for school entry. Infants who are traveling abroad should probably get the vaccine earlier. They can get it as early as 6 months if they are traveling, although they will still need 2 more doses. Anybody who is traveling internationally needs to be sure that they have 2 doses of measles vaccine. Many of the cases that we're seeing in Los Angeles are related to international travel. There are many large outbreaks of measles internationally. Then, as I said, most people can review with their provider and make sure that they've had at least 1 dose, but there are other groups we would like to urge to get 2 doses of vaccine. Those would be anybody who attends post-secondary education, such as a university, all healthcare personnel, any international traveler, people who are household contacts or caregivers of those who are immune compromised. People who are immune compromised cannot get the vaccine, so it's important that their caregivers are protected so they can't spread it. Anybody who is exposed in a measles outbreak, persons who are caring for infants, because as I mentioned, the vaccine is generally given at 1 year of age. Young infants are susceptible to measles, and it can be very serious in infants. Women who are pregnant cannot get the vaccine, but women of childbearing age who would like to become pregnant in the future should therefore get 2 doses of vaccine before they are pregnant. And also staff who work in congregate settings where there's a risk of spread. And we would like to recommend that those people get 2 doses of measles vaccine to protect themselves and the people around them.
Booster.
You want to talk about it?
Well, the, oh yeah, sorry. So that 2 doses includes the booster. So there's the dose and the second dose is the booster. So we don't need additional vaccine. So the question is, where should people get their vaccine? And most people, as I said, the next time you go to your provider, just ask about measles vaccine. Say, am I protected? And how can I document that I'm protected if I'm exposed? If people do not have providers, they can call 211, and we can direct you to places where you can get measles vaccine.
We're going to take questions
Yeah.
in a minute.
Thank you.
Oh, and then the last point is that we are working with providers. We sent out guidance in LA Health Alert to all providers, and we're going to send updated guidance today or tomorrow to share these recommendations with them.
So thank you. So we're going to now, we've given you sort of the overview. We're happy to take questions, and we'll clarify any information we can that we've presented on.
From those
But
5 people.
I'm gonna just start over here, and then I'll go straight to you.
Please start with Pete, but Dr.
Okay.
Ferrer, before you get started, I think you're probably going to answer most of the questions.
Well, and Dr. Davis is,
And Dr. Davis.
yeah, so maybe
You guys can
we'll sit right here. Okay.
Or maybe we can take some questions from the room, and then you can just ask Noah as
Oh,
operator
yeah.
to take questions from the public.
Great, thanks for reminding us.
Sure.
So-
Doctor, for the original 5 cases that we've got right now and exposures to Cal State LA and UCLA, at this particular point, how many people do we estimate were exposed? How many do you believe will have to be quarantined for anywhere from 2 to 7 days at both those campuses?
Yeah, I mean, it's a great question. I'm going to turn it over to Dr. Davis. I do want to say we've issued quarantine orders already, and there have been dozens of them, and we will continue throughout the outbreak to assess when we need to issue quarantine orders. But we're happy to talk. Obviously, since there was a library that was involved and it's a public building, they say they have 2,000 visitors in that library a day. Most of them don't sign in or out. So we've had a lot of exposure folks that we actually can't identify. So, but I'm going to turn it over to Dr. Davis. I think it's a good question to remind everybody, one person with a confirmed measles case can expose thousands of people to measles. One person with a measles case can expose thousands
Doctor,
of people.
it's a nice prophylactic explanation, but
So
let's
let me-
get to
let
the
me-
hard numbers, please.
We're on the air shortly.
You know.
Sure. So when we initially started the investigation, we ended up with over 200 some students that could have been unvaccinated or not immune to measles. Now that number is changing dynamically because as we've identified those and the schools have helped us do that, they are also helping us to confirm immunity in those students. And so that has been a dynamic process in terms of us getting lab confirmation or students actually showing up with their documentation of immunization, which is sufficient to keep them out of quarantine. But that's been dynamic over the course of the last few days. So I don't have exact numbers in that because we continue to get information in relationship.
Well, rough numbers, do you have any idea how many kids at either one or both of those universities might have to be quarantined and how many have been exposed?
So as I said, we've got a couple hundred. So we originally had a list, I think we had pared down to about 117
At UCLA.
And we are still getting numbers as we're doing assessments at Cal State LA, but that's harder to figure out only because, again, it's a public library and not everybody is going to be known who was in that library at that time. But both universities have been very cooperative and helpful and also helping those who we've been able to identify, and they've helped us identify to try to assess it.
Has CSLA been able to give you a rough figure? UCLA started with 500, went down to 130 roughly, and now you're telling us 117. What has CSLA given you in a rough figure?
That's what I'm saying. It's hard to say because you've got a public setting where not everybody is identified. So you've got, I think it was maybe it was like 20 or 30 staff that might have been in the
No,
library.
we have at the Cal State University, and they've been great. We've identified there's over 200 staff that work in the library. It was in the North Library was where the exposure was. There's over 200 staff there. We are working through with Cal State to identify the status of all of the staff who work there, excluding, obviously, from being at the library, any staff that we have not assessed their status. Those folks, so that's a known number of the people who work at the library. We have been in contact with the staff at Cal State. We're working very closely with them and are issuing orders to folks who cannot establish that they in fact have immunity, either because they're fully immunized or because they've had a blood test that establishes their immunity. Those are the folks who work there. There are an additional group of students who checked out books, and we have a record of those students, a very small number. We will again be working with those students to verify their immune status.
So
If we can't identify their immune status, we will be issuing quarantine orders for those students as well. We have issued a blanket order for all students, faculty, staff, and visitors who have been at the library, in the North Library on the campus at Cal State LA between the hours of 11 and 3 on April 11th. Any student, faculty, staff, or visitor who went to that library is asked to call health services at the university and identify themselves. Health services will work with those people to try to figure out their immune status, and will let us know when they can't verify immune status, so that those people then will be quarantined as well. That's an unknown number, but we have a blanket order that covers everybody who can't establish their immune status and was in the library between 11 and 3 on April 11th.
So I might just be confused, but I want to be
Yeah.
sure because it appears you folks are calling this a measles outbreak at UCLA and Cal.
No, we have not.
So
So
it's a
the
potential outbreak.
the definition of the outbreak was the 4 cases that were linked. That is the outbreak. We have all of these other cases that were separate, not linked together at all. And we have a number of individuals that were exposed related to some of those cases and where they have gone. We have not seen a case of measles in those contacts. So at this point, the outbreak number is 4, but we have a number of people who were diagnosed, up to 10, with measles who were in LA County.
And the 117 at UCLA, be clear about this. Are they going to be quarantined, or are you talking to them?
They will be quarantined if they are not able to provide their status of immunity, either verification, documentation of 2 doses of MMR immunization, or a blood test that says that they are immune.
So basically, they've possibly been exposed.
Yes, yes.
And you don't have any hard numbers on the kids over at Cal State or the faculty?
No, that's what Dr. Ferrer explained, but because of the open library and the unknown number of people or who exactly was in there at that time, it is hard to say what those numbers are, which is why there's a blanket order and statement that if you were in this area, you would need to be quarantined, notify the health center, verify your immune status, or you'll be quarantined.
Thank
What
you
is
for
the
clarifying that, sir.
quarantine process? What's that look like?
So the quarantine is actually a legal order. What it specifies is we understand that you were in a location that you were exposed to X case, not the person, but this disease. And I'm speaking in general, so not just for measles. With that, it says that you need to, because it's a risk of you coming down with the disease and further exposing others, you need to stay at a specified location, and you need to stay there until such time that you are deemed as not likely to come down with the disease, which is why for measles, it's up to 21 days after the last exposure. Now, if during that time the person can document that they have 2 doses of MMR immunization, or they can document in their blood that they are immune to measles, then the order is lifted. Otherwise, they'll be in quarantine up to 21 days from the last exposure.
And what's the absolute end date, if you would, as far as that for 21 days? For UCLA, what are we talking about? Sometime first week, second week in May?
No, UCLA would be next Tuesday,
Next
and Cal State LA would be next Thursday.
dates?
The 9th and the, I'm sorry, sorry.
30th, April 30th?
I'm sorry, I'm talking about the dates of
Let's
exposure.
go to UCLA first. What's the date to where you say after this point, you're clear? What date?
The 30th of April,
On UCLA?
yes,
Cal State LA?
the 2nd of May.
The state database right now says that there are 6 cases that have been identified in LA County. Of those, 1 is somebody who is under the age of 18. And then I think you said earlier it was 5 total. What's the difference there in the numbers?
It's the reporting. So their system, they do a reporting on a certain time frame, and we report, once we get stuff.
There's also a case in Pasadena that was reported earlier this year, so we have 5 from our jurisdiction. The 2 other health departments in the county report separately, and Pasadena reported a separate case earlier this year.
Do we know where patient 0 came from?
Where
Who came in first, traveled from abroad, kind of brought it back here? Do we know where that person went?
We do know where that person went. I'm trying to remember the first. First cases were those that traveled through LAX. They've traveled to, I believe it was Vietnam, and the other was Thailand for these recent cases that we're talking about. But the others have been in other countries as well. And I will say that all of these, except for the 3 that were transmitted from 1 case, were from travel. They picked it up outside of the county.
Vietnam and Thailand came back here and then met people here, and from there, away they go.
Yes.
That cluster, that 1 outbreak that we do have, where did that person travel from?
I believe that one was Vietnam.
Vietnam.
That one was Vietnam. Okay, gotcha. And then the other thing is, obviously, immunization is at the heart of a public debate right now, and we are at a level where a lot of these college students have come of age during the midst of this debate. is there an added complication by the fact that they've kind of come of age as parents have been questioning whether or not to immunize their kids? Is this making your job more difficult?
I would say that, one of the things that happened in California in 2016, a requirement of having 2 MMR immunizations for students coming into the campus or what do you call it?
Into colleges or universities.
Yeah,
is a
entering into
requirement.
college or universities is a requirement. So at this point, if anybody isn't vaccinated, yes, that's an issue. So that means that they are could potentially be exposed and could potentially come down with measles. Again, with measles, almost 90% of those who are not immune to measles will come down with the disease within 7 to 21 days. So yes, it does complicate things when people aren't fully immunized.
Is there data on, have we seen maybe a spike in immunizations over the past couple of weeks as this has become more evident?
We don't have that data yet. Obviously we're tracking what's going on in our own clinics. I will say we've had a lot of calls from providers who are looking for guidance. Who should they really be targeting? People are requesting immunizations. We're really glad people are trying to figure out their status. The one group that's very concerned with good reason are parents of newborns who are very fearful because babies under 6 months cannot be immunized. And there have been stories in the news, earlier today about the heartache of having your baby in a NICU with a very serious illness because they were exposed to measles by folks outside who weren't immunized, and babies get very, very sick. It's a really dangerous disease for a lot of people.
For people who have to be quarantined, can you tell them exactly what that means for them?
Yes, we do. We give them, we do a few things. We give them some notice and a long letter that really explains all of the conditions that we're asking them to adhere to. I think very importantly, we also give them a phone number. There is a dedicated call center that's set up that just is there to handle questions and concerns from people who we've ordered quarantined. So that's staffed by nurses so that we can make sure they're getting all the services they need. There are obviously situations where people who are quarantined may then come down with the disease. They then need to go to the doctor. Our nurses will work to do a safe transport and to safely have them seen, examined, and treated. So we put a dedicated group of nurses to help everybody who's quarantined. I also want to thank both UCLA and Cal State, who have really stepped up with their health services, also being of help to all of the members in their community,
But let's say you're
particularly
a college
those.
student, you live in a dorm, and you believe that you maybe have to be quarantined. Physically, what do you do?
Yeah, the colleges are working to make sure that anybody who's on our list or anybody who now self-identifies at Cal State has a place where they can go, because they're not allowed to be in their dorm, has a place where they can go to adhere to the quarantine order. So both universities have identified a space where their students and staff who live on campus can go if they have a quarantine order. They are not going to be in the dorms with other students.
So it's like a big room, and they'll all be staying there in cots, or what are we
There-
talking about?
I would actually defer to both of those universities to describe, because they're each handling it different, and obviously depends on the numbers.
So it's not just, let's say I have an apartment and I live off campus. It's not just stay in your apartment?
Oh, yes, it is. If you live
Okay.
off campus, you'll stay in your apartment under quarantine. We will, with our nurse, assess the status of everybody else in that apartment to make sure that everybody else is fully immunized that's in that apartment so that you can stay there.
So you're speaking only for people who live on campus that would have one location to go to?
Yeah, the on-campus, obviously, if you live on campus, the universities are setting up and a place for those folks who live on campus to go to adhere to the quarantine.
Basically a separate dorm or separate living
Yeah,
facility.
it's a separate living facility for them.
You guys have an end date on the UCLA case and on Cal State LA. I think UCLA more because there are a ton of kids who live on campus there. is there a concern that if another case pops up, another hot case pops up, that this is gonna last through the remainder of the school year?
I mean, I think in general, anytime we get a case, the question is where did that person go? And as a result of them going to different places, others could be infected. So I wouldn't say that because it's a university per se, that is the place that we think if it's going to be there, it's going to be months. The other thing is, if the students there are able to adhere to the requirements of entry, then the majority of them should be immune in terms of having the 2 MMR immunizations.
We're going to just stop. Good. There's some people that I just want to check on the phone. Was there anybody on the phone, Noah, that wanted to ask a question?
Not immediately, but we do invite them to press *1 at this time if you have a question and you are on the phone line.
Okay, then maybe just interrupt us, Noah. That'll probably be easier.
We did just have someone queue up. Paul Glickman from KPCC.
Hi, can I go ahead?
Yes, you can.
Hi, thank you. I just had a question based on what you were just talking about in terms of the quarantine of people who are on campus. You said that they have identified what sounded like you were saying as a communal space for those people. And I guess I think of quarantine as being a situation in which you would isolate each individual from anyone else. Otherwise, aren't you just, for putting all 100 people together in the same space, for example, aren't you heightening the risk of a spread?
I think it's each case will be looked at to assess whether or not it's feasible. I think in those instances where it is say an apartment that may be separate, then maybe that person can stay in that location. I think in terms of them trying to figure out what's possible, it's really trying to figure out how best to support those students who may not have another place to go, while at the same time, protecting the other folks in the university community. There is always a risk, if somebody comes down with measles and the folks there are not immune. So we try to figure out the best way to have people be protected and at the same time be away from others.
What do you recommend? What would be the ideal situation for on-campus people at risk?
Typically the ideal situation in general is to remain in your residence and to not interact with people who are not immune to whatever disease we're talking about.
And when you're talking about exposure on these campuses, you're not just referring to students, there could be faculty, staff, librarians, other folks, right? Because we don't want to freak out a bunch of parents and think it's just a horde of kids. It runs the gamut, correct?
Yeah, any time a person with the disease who could pass it at that time is in a location, it's anybody that's around in that location. And remember, again, we talked about measles in terms of potentially staying in the air for up to 2 hours or staying on surfaces for hours. After the person's been in the room, there's always that chance that whoever's going through that space, has been exposed.
At worst, how big of a problem could you have on your hands if you don't get your arms around this thing?
I think that it really depends on, again, the contacts who are not immune. If you're immune, it's not going to be an issue. If we have pockets of high levels of people who are not immune, then the likelihood that they may get disease is going to be higher.
So if these people don't step forward, who may have been exposed in those particular areas, we could be looking at something spreading through LA County.
I do want to say in general, and thanks to your help in a large part, when folks know that there's a serious risk, they usually do step up. We really find high levels of cooperation, and we count on that. We count on people self-identifying. We count on, them understanding that we're providing as much service to them as possible, and we count on them understanding how serious the risk is to others. So, and I do want to thank the media because you've been tremendous about alerting people to this possible threat. And we've been very impressed with the levels of cooperation. So, we count on that, but you're absolutely right. If folks are not paying attention or not aware, we do run a risk, unfortunately, because there are some pockets where people are not immunized. We do run a risk of spread, and it's why we're so diligent about where we know that somebody is a contact of someone who's a case, has measles, we will do everything we can to find that person and verify their status.
So the best case scenario at this point to avoid what could be a really big problem, should people just run out and get immunized as quickly as they can?
Yeah, I mean, we are encouraging people, particularly people who have greater risk because of where they are, where they travel, who they're in contact with, to please take advantage of this time when we're making it really clear how dangerous measles is. It's around, and it's not just in LA, it's around everywhere, that you protect yourself, your families, your loved ones, and other people in the community who cannot get immunized. So we agree with you. You know, people need to pay attention and figure out their immune status. And for those people, particularly who are going to be in contact with lots of other folks or who are doing a lot of travel, if they're in contact with babies, they need to make sure they've had 2 full doses.
And can we prevent other folks from other countries coming here and with the virus? I mean, or is that impossible to do? Are you working with LAX?
You have the virus and you're infectious before you have any symptoms.
Sure.
So, you know, as with most viruses, you're actually going to be contagious before you even know. So, I want to say, we don't think anybody intentionally infects other people. Unfortunately, this virus, like so many others, you're infectious before you actually know you're sick.
Can we talk about what measles is and what it is not?
So as mentioned, measles is a viral infection. It's transmitted through the air or could be picked up on surfaces. And much like other viral illnesses, again, fever starting off, could have body aches, cough, runny nose, or red, watery eyes. The unique thing about measles is often the rash, which comes later on after all of those symptoms, and can start on the hairline behind the ears and then progress down the body. It is a viral illness, so it cannot be treated with antibiotics. So it has to run its course in terms of the illness itself. There are few options that we have to try to prevent someone who was in contact who is not immune from getting measles, and that has to happen in a very short time frame. So if someone is less than 72 hours after contact and we can identify them, we can give them immunization, or if it's less than 6 days, we can give them, a provider can give them immunoglobulin to protect them. But those are the sort of the very rare instances. Usually, again, people are transmitting measles before they know, and usually that window period of exposure or the identification of a case is not rapid enough in order to be able to do that. But there are instances that it is.
Is it life-threatening and damaging?
It is life-threatening, especially for infants or children under 5, for pregnant women, for those who have weakened immune systems, and even for those adults over 20. The complications from it can be pneumonia, encephalitis, or swelling of the brain, and which could lead to death. Either one of those could.
I know this is like one of the most contagious diseases, viral diseases that exist, and it's pretty easily contracted. Given what you just said, in comparison to say like Ebola or something like that, it's not quite as dangerous. What I'm getting at here is that now you have a situation where you're kind of responding to this public health emergency. How instructive is this for perhaps something else that could be more serious down the line?
I mean, that's a great question, and obviously, you know, every time we deal with an outbreak, we learn from our response. There's always areas where, you know, we improve the second time around. And I want to give a lot of credit to the team here at the Department of Public Health. You all saw us in action around hepatitis A. We were probably the most successful county at dampening down that outbreak because this team is really persistent in using a very comprehensive approach. That being said, when there are large numbers of people that are not vaccinated and you have a highly contagious virus, it can create a big problem. And we can rapidly overwhelm our team with the number of contacts that we need to identify, find out their immune status, and decide whether or not they need to be excluded from certain activities.
running a little
Yeah.
out of time. Maybe see if there's any more on the phone.
Yeah, we probably just can take a couple more questions. Is there anything on the phone, Noah?
Yes, we do have a question from Patrick Munango from the City of Los Angeles Emergency Management. Please go ahead.
Hi, this is actually Taylor Lawrence with the Emergency Management Department. I'm the public health liaison, and I have three specific questions. So the 2 doses of the vaccine, say that somebody realized that they don't have record of vaccine and they need these 2 doses, how spaced do those doses need to be in time? Like, what is the time range of when they can get those doses? So that's my first question. My second question is...
Let's just answer that. It's 28 days, 1 month apart.
Okay, perfect. My second question is so public health memo that was sent out says that people born prior to 1957 most likely are immune by virtue of having had the virus as a child. So for people born in 1957 or earlier, are they required to present evidence of that? Or is it just taken as a given, 1957 or earlier, that those people are generally immune?
I mean, they're likely to be immune, but we want confirmation of that. And so we, would prefer that there is confirmation by blood if they're immune, or that they are immune, before we can safely say that they couldn't pass it on to others.
Okay, thank you. And then my last question is there any particular efforts that are being made with the homeless population?
This is Jeff Benson now, so I can just comment. The county launched a very interesting pilot at the end of the year, recognizing that homeless populations are really at risk of a variety of communicable diseases. Dr. Davis has led this, but it's called the Housing for Public Health Program. We're working with the County Executive Office and a variety of other departments, and we have a pilot that's actually being launched next week where we're coupling some of our vaccination efforts with other county efforts. So yes, we're very concerned. We don't think they're particularly at an increased risk, but we want to provide them all the vaccinations that adults elsewhere in the county would have access to. So we're hopeful that we'll learn from this pilot and find improved ways to assure the vaccination of homeless persons in the county.
Okay, thank you very much.
Thank you.
If we're wrapping up, I came in
Yes.
just a little bit late. I just want to make sure I understand the latest numbers. Could you just give us just a rundown of the latest numbers and the locations?
Yes.
Okay.
We have, well, go ahead.
So we have 5 resident cases and 5 cases in travelers through LA County. In terms of what we're talking about in terms of exposures at UCLA and at Cal State LA, the others, we have not identified anybody that at risk, from those other cases.
Yeah, we are, of course, suspect cases will go through our lab, and, we're being aggressive, and so we have, cases that, have had, folks submit tests to see whether or not we will have any additional cases, and we appreciate that, physicians and providers are doing all the testing of suspect cases and getting that to us as quickly as possible. Obviously, they play a big role in helping us quickly identify a case of measles so that we can begin to protect folks from exposures.
One last thing, because again, this gets down to the question of where did one of the cases of possible exposure at UCLA and Cal State LA come from? Do those come from the 5 resident cases?
Yes.
Or from the 5
Resident cases.
Right, so 5 resident cases.
Yes, the exposures were residents.
And the original source for that resident case, do we know?
Travel.
All right.
So most of the people who have measles in LA County got it through travel?
No, they either got it through travel or they were exposed to a person who had measles, who traveled, and they had no immunity.
And I will repeat that it was 1 case that traveled that transmitted to 3 that had not. So there's 4 in terms of that.
And then the 5th case traveled independently.
Maybe time for one more question.
Yeah, we're going to. I don't think there's anything on the phone.
I heard this morning on a call with California Department of Public Health that it was like 76% of people who have who were vaccinated didn't get the disease. So was everybody immunized who ended up getting, or not immunized who ended up getting the disease?
The majority of our cases have not been immunized.
the majority, so there was more than at least one that was immunized.
Yeah.
Do we know how many?
A single dose.
A single dose.
Oh, and a single dose a long time ago. So
Okay.
this is why we are emphasizing that certain groups of people should get 2 doses, to make sure they have 2 doses. In general, we encourage 2 doses, but 1 dose of vaccine is good, 2 doses is better.
Perfect, thank you.
We're probably gonna end.
Yeah.
Just, I know we've only got this room for a few minutes, so.
And
You
just
own the building.
We don't,
How many
we
people have
bounce
identified at
people
each
out,
college that
so.
we know have measles? Is it 1 at each college, or we?
Yes, it was there was 1 case at each
At
college.
each college?
Yes.
And the, you mentioned Cal State LA was the North Library. What was
Yes.
the location at UCLA?
At UCLA, it was classrooms,
Okay.
student who was in different classrooms.
So we got 1 student at each place? and
Yes, a
exposed
different
possible-
student.
Okay, gotcha.
And Noah, and for those on the phone, thank you all for joining us. If you have follow-up questions, also anyone in the room, please email our media line and check out our press releases, because most of this information you'll find in there. I think that's it for us, Noah. Thank you.
Have they said specifically which classroom, so that students would say, oh, I'm in that?
Yeah, we have, and it's in our press
Is it on
release.
here? Okay.
Yes.
Exactly.
Where we have really good information, we've given really good location information. We have a lot of work.
Thank you for deciphering that last question. I'm struggling to get it out.
Oh, they were good questions. And we appreciate,
Where it has the classroom?
Scale of 1 to 10, students are about 5.5.
It's kind of like.
excuse me?
Guys, you need to go tactical on this.
Yeah, no worries, Bill.
You don't need a complete epidemiological study for how many.